Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Huria Ahmed. Today we are going to learn about electroencephalogram. The electrical wave study over there from the brain surface is known as electroencephalography. And along with it, we are going to learn about different conditions related to it, like sleep, the types of sleep, epilepsy, etc. So, what is it? Let's talk about this in detail. Electroencephalogram is the study of electrical activities of brain. It is a graphic recording of electrical activities of brain. German psychiatrist Hans Berger was first one to analyze the electroencephalogram systematically. So, the EEG waves are referred as Berger's waves. You can see that from the surface of the head, that is from the scalp, this electrical activity recording that is being done. You can compare it with that of the ECG, which is done from the surface of the heart. The electrical activity recording from the surface of the heart, and that is quite comparable over here with that of the electrical activity taking place in the head is recorded by this EEG, known as the EEG waves or Berger waves. Now, what is the significance? Now, EEG is useful for the diagnosis of neurological disorders and sleep disorders like epilepsy, midbrain disorders, subdural hematoma, epilepsy, which occur due to excessive discharge of the impulses from cerebral cortex. Midbrain disorders, which affecting the ascending reticular activity system. Subdural hematoma. Method. Now, what is the method of recording the electroencephalogram? Now, the potential differences are recorded in two ways. That is, between the pairs of electrodes on the scalp, bipolar electrodes, between individual scalp electrodes, and relative common reference points, that is, the unipolar electrodes. Electroencephalogram can be recorded from a patient in waking condition or during sleep. Now, let's talk about the waves of EEG. Now, in normal, the electroencephalogram has got 4 different types of waves. And the waves, they are alpha, beta, theta, and delta. Now, what are alpha waves? Alpha waves, they are rhythmic, having the frequency of 8 to 13 Hz, and they are mostly recorded on the occipital lobe, having 20 to 200 micron volts, and they are being closed when the person is normal, relaxed, awake, and with the closed eyes. Now, beta waves. Now, these are not regular waves. They are irregular, having the frequency of 14 to 30 Hz, and mostly recorded from the temporal and the frontal lobe of the brains, and the voltage of around 20 micron volts, and recorded not during relaxation but when the person is mentally active, and record during RMP. Now, theta waves. They are rhythmic waves having low frequency between 4 to 7 Hz, and voltage is around 10 micron volts, and recorded during light sleep. The person is drowsy and in temporal region. Then the delta waves, they are very slow, less than 3.5 Hz, and during the course of normal sleep rhythm they're being recorded, and they are mostly seen in case of adults. Now you can see the beta waves when the person is working, alert, or during the course of high mental activity, And alpha waves, they are regular ones and they are relaxed. Theta, when the person is drowsy. Delta, when the person is sleeping, dreaming, and also during dreamless sleep. Now, the different type of brain waves in the normal electroencephalograms, you can see alpha, beta, theta, and delta. So in children during the course of sleep, you can see the theta and delta waves, right? And we have to learn that the beta ones during the course of mental activity, and the alpha ones when the person or adult is actually at rest, eyes closed. And now let's talk about what happened when the changes they are there. Now, what different type of changes we can see if there is presence of a desynchronization or the alpha block that is seen. Now, this desynchronization of alpha block is seen actually when the eyes they are open after so long closure, and when the person is thinking. So there is a sudden change, like if the person starts to do mathematical calculation, or if the person hears some sound like clapping or so. Then thinking. When the person is thinking, during the course of thinking, the mental alertness that is there. So the beta waves, they are being observed. Now, what is the actual use of EEG? It is actually used for learning the depth of anesthesia, electrocerebral silence, epilepsy, localized brain tumors, subdural hematoma, the sleep disorders, polysomnography, narcolepsy, sleep apnea syndrome, insomnia, parasomnia, helpful in knowing the cortical activity, the toxicity, hypoxia, encephalopathy, and determination of brain death. Flat electroencephalogram, absence of electrical activity on two records, run 24 hours apart. Sleep. Now, sleep is quite an important topic and frequently being asked in exams as well as in viva questions, that sleep, what is it? It is actually a period of inactivity during which there is unconsciousness from which the person can be aroused by sensory or other stimuli. Electro-oculogram measures the electrical changes as the eyes rotate in its socket. The electrodes are placed either above and below the eye or left and right of the eye. Electromyogram, it measures the electrical changes generated during muscle contraction. The electrodes are placed under the chin. Electroencephalogram, electro-oculogram, and electromyogram, they are recorded simultaneously, and the patterns of activity in these three systems provide basic classification for different types of sleep. You can see where these contractions, or you can say the electrical activity that is being recorded. The sleep studies, they actually show that electroencephalogram is going to tell us broadly about different sleeping disorders, especially the sleep apnea, polysomnography. There is electroencephalogram activity together with the heart rate, airflow, respiration, limb movement, oxygen saturation. They are being done. So requirements. The requirement varies in different ages. Like infants, the duration is like so many hours, up to around 20 hours. Young children, like 12 hours, and adults 7 to 9 hours, and in middle age 5 to 7 hours. Generally during sleep there is sympathetic inhibition and parasympathetic stimulation. So the sleep patterns, there are two different kinds of sleep. There is rapid eye movement sleep and non-rapid eye movement sleep. Non-rapid eye movement sleep is again divided into 4 stages, that is stage 1 to stage 4. The EEG pattern in sleep is given in the following table. The characteristics of rapid eye movement sleep. In an active form of sleep usually associated with dreaming and active bodily muscle movements, the person is even more difficult to arouse by sensory stimuli than during deep slow wave sleep, and yet people usually awaken spontaneously in the morning during an episode of rapid eye movement sleep. Muscle tone throughout the body is exceedingly depressed. Heart rate and respiratory rate usually become irregular, which is characteristic of the dream state. Despite the extreme inhibition of peripheral muscles, irregular muscle movements do occur. Brain metabolism may be increased as much as 20%. The electroencephalogram brain waves similar to those that occur during wakefulness. This type of sleep is also called paradoxical sleep because it is a paradox that a person can still be asleep despite marked activity in the brain. Now, what are the stages of slow wave sleep? There is alertness, when alpha activity on eye close, desynchronization on eye opening, and they respond to verbal commands. Drowsiness. There is alpha dropout and appearance of theta waves that is there, and reduced heart rate, a reduced respiratory rate. Then light sleep. Sleep spindles, they do come. Vertex, sharp waves, and K complexes, they are there. Reduced heart rate, reduced respiratory rate. Then we have the deep sleep, much slow background, K complexes, reduced heart rate, and respiratory rate. Very deep sleep, synchronous delta waves, some K complexes, reduced heart rate and respiratory rate. Rapid eye movement sleep, desynchronization with faster frequency. Now during this there is increase and in heart rate, blood pressure, respiratory rate, they become irregular. There is hypotonia, there is rapid eye movement, 50 by 60 per minute, dreaming threshold of arousal that is there. You can see the changes in brain waves during different stages of sleep and wakefulness. Now, what is the mechanism of sleep? Now, sleep occurs due to activity of some sleep-inducing centers in the brain. Stimulation of these centers, they lead to the induction of sleep. Damage of sleep centers, they result in sleeplessness or persistent wakefulness called insomnia. Sleep centers, complex pathways between the reticular of brainstem, diencephalon, and cerebral cortex are involved in the onset and maintenance of sleep. 2 centers are located in brainstem, that is raphe nucleus, locus